So hello everyone, I am Mariah Angela F. Pineda, a student from BS Nursing 2 here in College of Our Lady of Mount Carmel. So the procedure that I am going to do is administering fleet enema. So for the assessment, before administering enema, we have to determine the primary care provider's order. Then gather all of the equipment. So we would have the fleet enema, the incontinent pad, paper towel, clean gloves, the bedpan, bath blanket, and the water-soluble lubricant. For the nursing diagnosis, it would be constipation related to pain on defecation secondary to hemorrhoids as evidenced by patient reporting that she has not had a bowel movement for 5 days, hard stool and rectum pressure, and also painful on hemorrhoids. For the outcome, the patient will be able to have a bowel movement before discharge. Then for intervention, we have to introduce ourselves to the client and verify the client's identity. So hello ma'am, I am Mariah Pineda, your student nurse. May I know your name and birthday? So ma'am, I will have to administer fleet enema so that you can have a bowel movement. Would that be okay with you? Then after that, we have to perform hand hygiene and observe infection prevention control. Then we also have to wear the gloves. Then we have to provide client privacy. So we have to close the door or curtains if possible. So assuming that we have already closed the door and curtains, now we're going to place the bedpan or the commode on the position of the patient who cannot ambulate to the toilet or has difficulty on sphincter control. So we have to assist the patient to a left lateral position with the right leg as to facilitate acutely flexed as possible. So ma'am, I want you to move towards there and I will be assisting you at the count of 3. Okay. 1, 2, 3. Then put on the bedpan. So ma'am, can you please lift your hips for a little? 1, 2, 3. Then we have to expose only the area that is needed. So ma'am, I will be exposing your anal area, okay? Then after that, we have to get the fleet enema and put on a lubricant so that it would be smooth and easy for the patient. Then we have to inform the patient what we are doing or where we are touching. So ma'am, I will be just assisting your hips. And then, ma'am, you may feel a pressure but do not defecate yet so that I could help you to the commode once you are ready, okay? Then put on the enema and administer and squeeze all of the fluids. This should follow the rectum, directing to the umbilicus. Once done, remove the enema. Then, clean it with a paper towel. Then, after that, we're going to do aftercare. So make sure that the patient is comfortable. So ma'am, I will be assisting you to your previous position, okay? So we have to also cover the patient to restore some dignity. So ma'am, at the count of 3, 1, 2, 3. Then, ma'am, you should hold it for at least 30 minutes, okay? Then, give the call light. So ma'am, here is the call light and use it once you are ready or once you need us. Then after that, we have to discard our gloves. Then again, wash our hands and perform hand hygiene. Then after that, for evaluation, we have to report any significant problems such as redness, excoriation, or swelling. And episiotomy should be noted for edema, inflammation, or presence or separation of hematoma. Then we also have to take note of the odor or color of any discharge and document the procedure as well as the patient's tolerance regarding the procedure. And that would be all for administering plate enema.